Welcome to the Deep Dive. Today we're looking at something pretty significant happening in the American workforce, but it often gets overlooked.
Mm,
We hear a lot about tech or maybe manufacturing struggles,
right.
but there's this other sector quietly reshaping things, and it's massively driven by women. We're calling it the heel economy.
Yeah. Heal.
Yeah.
Health, education, administration, literacy.
Exactly. So in this deep dive, we're going to unpack how women came to really dominate healthcare work, why men are still relatively scarce there, and, what does it all mean for jobs in the U.S. going forward?
Right.
Get ready for some, I think, surprising facts and maybe a few aha moments about work and care.
Our mission really is to get past the headlines. We
Mhm.
want to explore the data, the trends, and crucially, this sort of cultural forces behind this huge shift in these very human interaction service jobs.
It's fundamental, isn't it?
It really is a foundational change in the economy that needs a closer look.
Okay, so let's define heel economy a bit more. Health, education, administration, literacy. These aren't niche jobs anymore.
Not at all.
They make up something like 1 in 7 U.S. jobs now, and they're projected to keep growing.
Definitely growing, especially, as the population gets older and we see more need for chronic care.
And the contrast is really striking when you put it next to, say, traditionally male-dominated industries.
Oh, absolutely. Look at manufacturing. It's seen such a sharp drop.
How much of a drop are we talking?
Well, between about 1994 and 2024, manufacturing lost nearly 3 million jobs for men.
3 million, wow.
Yeah, it's a completely different story than HEAL.
And job creation in that same time frame. The
Yeah.
difference is incredible. Healthcare and social assistance, just those added about 9 million jobs for women
9 million.
and about 3 million for men. So that growth for women, just in that one area, it's bigger than the growth in all other private sectors combined.
Think about that. It really tells you something.
What does it tell you? What's the takeaway there?
Well, it signals a labor market where women's job growth is just overwhelmingly packed into caregiving,
Right.
whereas for men, the growth is more scattered and still really tied to those cyclical trades, things that can fluctuate a lot with the economy.
That concentration has big implications, I imagine.
Huge implications for economic resilience, yeah.
So let's zoom in a bit on healthcare itself,
Yeah.
the current picture. What does the workforce look like right now?
Overall, it's about 4 out of every 5 workers in healthcare are women, nearly 80%.
80%. That's a massive imbalance right out of the bat.
It is.
And then if you drill down into the frontline roles, the sort of hands-on jobs,
It gets even more pronounced.
give us some examples.
Okay, well, take dental hygienists.
Yeah.
Only 6% male.
6%. So like one guy for every 15 women.
Roughly, yeah.
Yeah.
And that's despite male enrollment in those programs surging like 130% since 2000.
Yeah.
It barely moved the needle on the job itself.
Wow. Okay, what else?
Medical assistants, about 9% male. It's often called a heavily pink-collar job.
So the term itself says a lot.
It does. Nursing assistants, too. They're crucial on hospital wards. but it's
Absolutely. Backbone.
Only 11% male. Men are just scarce there, even with staffing shortages. Women hold over 90% of all the licenses.
90%.
Then you've got nurse practitioners, registered nurses, even with advanced credentials, still only 12% male.
So education level doesn't erase it.
Doesn't seem to. And even home health aides, which is the fastest growing direct care job.
Huge demand there.
Huge demand, yeah.
Yeah.
Still just 13% male. Deeply feminized.
So these numbers, they're not just statistics, are they? They point to something deeper.
Exactly. It really highlights this deep-seated cultural coding. Who society expects to do this work.
And maybe who feels comfortable doing it.
Right. That societal narrative is powerful. Now, it's worth noting, not every single role is quite that tilted.
Yeah. Okay.
Some are a bit more mixed. Physical therapists, for example, they're about 35% male.
Better, but still majority female.
Still female-led, yeah, but it's the most mixed of the ones we looked at. Lab technicians pull in more men, about 28%.
Okay.
And you see a bit more male presence in management roles like health services managers, around 27% male, a modest number entering leadership tracks.
Interesting. Still mostly women, even in management, but a bit more balanced than the front lines.
Right.
Okay, let's unpack this then. This leads to the big question, why? Why does this huge gender gap persist, especially in such a booming sector?
Well, a major driver is definitely cultural expectations.
The women's work idea.
Exactly. It's been coded that way for so long. And that can really deter men. They might worry about stigma or just feel like they won't fit in.
It's like an invisible barrier almost.
It can feel that way.
Makes you wonder how many potentially great male caregivers we're losing because of these lingering ideas.
That's a real cost, probably.
And then there's the pipeline, right? Getting people into the training to begin with.
Yeah, the pipeline effect is real. Nursing schools are a prime example, even with recruitment campaigns aimed at men.
You still see way more women enrolling.
Far more. Fewer than 2 male students for every 20 females, roughly. It's hard to change those established flows.
Gotcha.
Then you get into the wage dynamics and this interesting thing called the glass escalator.
Glass escalator, what's that?
It's this idea that men who do enter female-dominated fields often get promoted faster into leadership or higher-paying
Get
specialists.
faster than the women in those same fields.
Often, yes. And that's compounded because a lot of the hands-on care roles just pay less than, say, technical jobs that require similar levels of education or skill.
Which might push men away from the front lines or out of the sector entirely.
It can reinforce that, yeah. Why stay in a lower-paid role if there's perceived faster advancement elsewhere, or if other fields pay more from the start?
Okay, here's a mind-blowing fact that seems to illustrate that perfectly. We said women hold over 90% of nursing assistant licenses.
The entry-level, lower-paid role.
Right. But get this. Men make up nearly half of all nurse anesthetists.
And nurse anesthetists are among the highest-paid nursing specialties.
Exactly. Average earnings over $200,000. So men are scarce overall in nursing, but heavily represented in one of its most lucrative specialties.
That is a textbook illustration of the glass escalator concept in action.
It really is stark.
And another piece of the puzzle is job security and flexibility.
How so?
Women often point to things like stable hours, predictable schedules.
Which healthcare often provides.
Right. And the option sometimes to work part-time, which could be crucial if they're also juggling caregiving at home. These might be bigger draws for women, or perhaps just less emphasized in fields men traditionally dominate, like construction or warehousing.
That makes sense. And then there's a policy angle too, isn't there? A sort of mismatch.
Yeah, what do you mean?
Well, think about how much effort goes into getting girls into STEM. It's mainstream now, right? Lots of programs, funding.
Oh, definitely. Huge push there.
But where are the equivalent big campaigns pushing boys towards heal careers, towards nursing, towards teaching, towards social work?
That's a great point. It's much less common, even though the economy clearly needs and increasingly rewards those relational skills.
Seems like a disconnect.
It does. And underneath all this, you have these big structural shifts happening.
Like what?
Well, economic restructuring, automation, offshoring. Those hit manufacturing hard,
Yeah.
and those were jobs mainly held by men.
Right, the jobs disappear.
While at the same time, you have demographics, the huge baby boomer generation getting older.
Fueling demand for care.
Exactly. Creating steady, almost recession-proof demand for nurses, for aides. It's a constant growth engine.
And one last piece, maybe more practical for individuals, education costs.
They can play a role too, yeah. A lot of these heal jobs, you can get in with a certificate or an associate's degree, not necessarily a full 4-year bachelor's.
Which might feel more achievable or affordable for some women, maybe, with tuition being so high.
It could be a factor in making that pathway more accessible for some, yes.
Yeah.
So if we kind of zoom back out, connect this to the bigger picture, the implications go pretty wide.
Right. And here's another statistic that just hammers this home for me.
Okay.
Between 1994 and 2024, healthcare alone created more net new jobs for women
Yeah.
than all the goods-producing industries combined lost for men.
Wow. Say that again. More jobs gained for women in just healthcare.
Then were lost for men across all of manufacturing, construction, mining, everything combined.
That's not just a small adjustment. That's a fundamental rebalancing of the workforce.
Totally.
And it's not just happening in the U.S. either. If you look globally,
What do you see?
globally, women are delivering about 70% of all health and social care.
70% worldwide.
Yeah. But here's the flip side. Men still hold about 3/4 of the senior leadership jobs within that global care sector.
So even where women dominate the work, men dominate the leadership.
That's the pattern. A real stubborn vertical segregation, as they call it. It persists across many countries.
And the end result for the U.S. workforce overall, it's profound. In 2024, women's share of the entire U.S. workforce actually tipped over the halfway mark, 50.4%.
Driven largely by that steady hiring in healthcare and also retail.
Exactly. While at the same time, men's labor force participation rate is hovering near its lowest point since World War II.
So the core insight here isn't just, women work in healthcare.
No, it's much bigger than that.
It's that these care professions, this heal economy, they've become the real backbone of American job growth, and women are undeniably the main architects of that.
Driving the care economy forward.
While men remain much more concentrated in industries that are either shrinking or just not growing nearly as fast, it subtly but powerfully redefines things.
Yeah, like traditional ideas about gender roles, maybe. What we value as work.
Exactly. It raises big questions about masculine versus feminine work and what a truly resilient, future-proof economy looks like.
And look, closing this gender gap in HEAL isn't just about fairness, though that's important.
Right. It's practical, too.
It's essential if we're going to meet the country's future health needs, especially with that aging population we talked about.
Absolutely critical.
So that's going to take work, cultural shifts, probably,
Definitely.
targeted recruitment to actually get more men considering and entering these HEAL roles.
And serious policy attention on wages and creating real career ladders in caregiving so it's seen as a viable long-term profession for everyone.
So the final thought for you, our listener, to maybe chew on, what does all this mean for you, for how we all define work and care in our society? How might these really deep shifts impact the next generation and really the whole fabric of our economy? Something to think about.